You're listening to the Health and Happiness Podcast with Travis Kemper and
Lauren Maxwell. Each episode, we share easy-to-implement strategies to improve your health, happiness, and overall quality of life. Indeed, marijuana is less toxic than many of the drugs that physicians prescribe every day. Dr. Jocelyn Elders. How's it going, Travis?
Good. We just got back from visiting Mesa Verde National Park for the weekend.
How fun! Also,
yeah.
It was your birthday weekend. Happy
it was my
birthday,
birthday
Travis.
Thank you. But some of us don't care about that.
I
care. I am another year older.
Yay!
Yay. So at the park, really cool cliff dwellings. So we did all the tours that they had. It was cool. And the drives from here to there are gorgeous. So all the leaves are changing colors, and it was just gorgeous over and over again, going over the passes through Telluride and Durango and all that stuff. So it was really cool. Tomorrow I start my new work schedule.
Oh, nice.
I'm very excited about that and hoping that it decreases some of my computer burnout at work.
Yeah, that's necessary for sure.
Yeah. What's up, Lauren?
Life's been great. It was a really busy week last week, but other than that, it's been great. We had a really, really fun weekend this weekend. Keely got to meet a new friend on Friday, and they got along super well. And then we went out to Dark Sky Brewery Friday evening with some friends. And then Saturday, we did our first fall hike of the season with some friends and our pups. Got to see the changing leaves, and oh my gosh, it was so beautiful. Keely loved it, especially because she got to be off leash almost the whole time and did such a good job with her recall out in the woods. We were very proud of her. Yeah, we've been working really hard on her recall, so she earned her.
It's a totally different game, like around your house versus out in the woods where there's a billion new smells.
Oh yeah. I know. I was really impressed. We were
good for her.
Man, we've done a good job so far.
Good.
So what are we going to talk about today, Travis?
Marijuana and pain. With marijuana becoming increasingly legal and increasingly used for medicinal purposes, combined with the news this week that people who were arrested by the federal government for possession will be released, I thought we should look into whether there are medicinal benefits that are well supported. I am specifically interested in pain because of my patient caseload, and that is what I have seen it used for the most. And learned my uneducated hypothesis for the pain benefits has always been that it is likely a placebo. I've never really looked into the research. I don't prescribe drugs, so it really hasn't been pertinent in my practice as a PT to research marijuana. But it is interesting to me as it is a potential safer alternative to traditional pain meds such as opioids.
Yeah, so marijuana can be used for pain, but it has also been used for other conditions as well. Specifically with pain, it can be used for chronic pain, including pain from nerve damage. It can also be used to control nausea and vomiting. The most common use is for nausea and vomiting caused by chemotherapy from cancer. It can be used to make a person feel like eating. This helps people who do not eat enough and lose weight due to other illnesses such as HIV/AIDS and cancer.
Hey, Lauren. I'm sorry to interrupt you, but I have a side note tidbit about the nausea and vomiting.
Oh, you do?
With chemotherapy.
Yeah.
I saw a recent, I think it was a meta-analysis that was talking about nausea and vomiting, and they concluded that the nausea and vomiting is just a nocebo because every single person in this world knows that you're going to vomit when you have chemotherapy. But if you don't know that going in, or if the doctors tell you that isn't that crazy?
That is shocking. I did not know that. I got goosebumps.
Yeah, I read that recently and I was like, whoa, like, no way.
No, geez, that's crazy.
Yeah, so I don't know how well that research study was conducted or anything like that, but that was definitely their conclusion, was that it was all because of a nocebo, which we talked about in a different episode.
Oh my gosh.
Your brain is ridiculously powerful. and you can make yourself vomit it by thinking you're going to vomit. Is basically what they concluded.
Well, I have so many questions that just spiraled out of that, but I'm gonna keep focused.
Sorry to interrupt you. Keep going.
No, that was really interesting. Thank you for sharing. Some small studies show that marijuana might relieve symptoms in people who have multiple sclerosis, Crohn's disease, inflammatory bowel disease, epilepsy, and they found that smoking marijuana lowers blood pressure inside the eyes, which is a problem linked to glaucoma, but the effect does not last long.
Cool. So what medical conditions can qualify for a medical marijuana card? Usually it depends state by state. Most common ones include cancer, HIV or AIDS, seizures and epilepsy, glaucoma, severe chronic pain, severe nausea, extreme weight loss and weakness or wasting syndrome, severe muscle spasms, and multiple sclerosis.
There are some side effects, which like there are with everything. Some possible physical symptoms from using marijuana include a fast or irregular heartbeat, dizziness, slow reaction times, and drowsiness. Possible mental or emotional side effects include a strong feeling of happiness or well-being, which is pretty much the happiest, most positive side effect I've ever heard of.
Yeah, they usually don't talk about positive side effects.
Yeah. Short-term memory loss, trouble concentrating, confusion, and decreased or increased anxiety.
That's also a little bit of a confusing one.
Yeah.
Lauren, of course, using marijuana makes you fat, right?
You know, I didn't actually realize this was something that people thought. Is this because marijuana can cause the munchies?
Of course.
Oh.
So marijuana and weight gain has been studied. A 2020 study determined that marijuana did not lead to increased obesity rates, and they actually found that it may have led to a decrease in obesity. Apparently, people that use marijuana have lower BMIs than the general population, which is interesting.
Yeah.
A 2021 study found that marijuana use after bariatric surgery was not associated with decreased weight loss or with increased complications. So it was safe for those people and did not have negative side effects with their weight. Mm-hmm. However, there is some research that has found that marijuana can be used for frail patients in order to increase their appetite. Being frail is pretty much just as dangerous as being obese. It's just not near as common, so you don't need to talk about it that much.
Yeah.
So that's interesting and inconclusive, but it does sound like there's not that much evidence that it'll cause people to gain weight in a bad way.
Yes.
As I said earlier, the most common thing I hear about it is that my patients are trying to use it for pain control. Opioid prescriptions for chronic pain and subsequent opioid-related complications have risen dramatically in the U.S. Recent data suggests that medical marijuana laws have been associated with lower state opioid overdose mortality. That is huge.
Wow.
A national survey in 2019 examined the prevalence of substitution of marijuana for opioids among U.S. adults taking opioids for pain management. And they found 41% of the patients reported a decrease or cessation of opioid use due to the marijuana use. 46% reported no change, and 8% reported an increase in opioid use. Better self-reported pain management and fewer side effects were also reported, and withdrawal symptoms were the most common reasons for substitutions.
Yeah, that's pretty huge. 41% reported a decrease or cessation of opioid use.
Yeah, and better pain management and fewer side effects.
Yeah.
So yeah, I would say that's pretty good.
Yeah, that's awesome. A 2018 study found that states providing legal access to marijuana through dispensaries reduced deaths due to opioid overdoses, particularly prior to the October 2009 Ogden memo, when dispensary systems were not as tightly regulated by the states. They also provide evidence that dispensary provisions lower treatment admissions for addiction due to pain medications. Or addiction to pain medications, sorry. Furthermore, this study reveals that while legally protective and active dispensaries remain an important factor in reduced opioid harm, the magnitude of this component of the policy has changed since 2010, when states more actively and tightly regulated marijuana dispensaries, and as the opioid epidemic has shifted toward heroin consumption.
So am I understanding that correctly? Like the effects were better before 2010 when the state governments jumped in and more actively restricted the use of marijuana?
Yeah, now
I'm
it's all
shocked,
skewed.
Lauren.
Now
I'm
it's all skewed.
I'm shocked that they did something and it had significant negative effects and increased heroin usage. Nice job.
Oh boy, good trade.
We should probably put them in charge of more stuff. So there was a 2022 randomized control trial involving 186 participants that studied the risks and benefits of obtaining a medical marijuana card for adults who seek medical marijuana for pain, insomnia, and anxiety or depressive symptoms. So they're looking at a lot of different things here. They were split into two groups. The immediate card acquisition group was allowed to obtain a medical marijuana card immediately after the randomization. The delayed card acquisition group was asked to wait 12 weeks before obtaining a medical marijuana card. And all participants could choose cannabis products from a dispensary. They could choose the dose and they could choose the frequency of use. They could also continue their usual medical or psychiatric care. So I read this study, and basically what they found was that there was no significant improvement in pain, anxiety, or depressive symptoms, but they did find an improved self-reported sleep quality. But reading this study, if you're allowing the patient to choose the dose, the product, and the frequency of use, it's a terrible study.
I mean, you're getting no consistency. Like, what are you actually studying?
You're studying nothing. So the reason that we included this was because it was reported on several news channels. So I just thought we should cover it because it's recent and it was reported. But yeah, it's a terrible study as far as scientific studies go, and that's most of what we found.
Yes. There was a 2020 retrospective study that found that medical marijuana improved oncology patients' pain scale scores despite opioid dose reductions. They concluded that medical marijuana should be considered as a viable therapy for palliative management.
So they found the same thing as the other two studies that found, less opioid use and less pain. That's
sounds like a good deal to me.
Yeah.
Another potential use that I was interested in investigating is cannabis and cannabinoid effect on epilepsy, because this is something that I see all the time in the field that I work in with pediatrics. I have a lot of kids on my caseload who have epilepsy or have like very intense seizures and seizure activity like very often throughout the day. And these kids are on pretty intense seizure medications that, like, if it actually does anything to reduce the seizures, these kids are usually very sedated, which is not really a good trade-off. I mean, like, I guess in a sense, you know, they're not having seizures, but then like they're sleeping all the time, and what kind of a quality of life is that? Like, we're not really getting to work on anything. They're not like getting to be awake and learn and take in the world. It's just like it's not a great trade-off. So go ahead.
Yeah, we've talked about we had a whole episode on the negative effects of our traditional medicinal use in this country and how they're always just overlooked.
Yeah.
And kind of like brushed to the side. And it's like, well, they're kind of important.
Yeah, you know, it's super important.
Yeah, whether it's your patient sleeping all the time or my patient falling and breaking their hip all the time, those are important things that lead to death or decreased quality of life or 100 other problems. Your patient's probably gaining more weight than they should and have less muscle than they should
Right.
because they're asleep 90% of the time.
Right, exactly. And then you're taking other medications to like combat the side effects of the first medication, and then you're on multiple medications. And like, I'm working with babies. Like, these are tiny little bodies who end up on multiple prescriptions. It's just, anyway, I'm gonna calm down for
Yeah.
a
So,
second.
do you have any good evidence for
Yes. Yeah. So that's the
cannabis
question, right? Is a
on
lot of my families have
epilepsy?
been bringing this up and saying, oh, well, we're thinking about trying cannabis or CBD for these kiddos. So the good news is a 2018 systematic review found that across 17 observational studies, 48.5% of patients reported 50% or more reductions in seizures with use of cannabis or cannabinoids. In 14 observational studies, 8.5% were seizure free.
That's pretty awesome. They need
That's
to do a lot more
huge.
studies. That's pretty
Yeah.
amazing. Yeah.
Yeah.
Yeah. So there's also been some studies on medical cannabis and mental health. A 2017 systematic review found preliminary evidence that suggests that medical cannabis may have potential for the treatment of PTSD and as a substitute for problematic use of other substances. If you know anything about usually when they're talking about PTSD, they're talking about military, ex-military, and the use of drugs, alcohol, opioids is really, really high among these mostly gentlemen that are experiencing PTSD. So that's what they're talking about as a substitute for problematic use of other substances.
Mm-hmm.
They also found that the use of medical cannabis may be problematic among individuals with psychotic disorders. So, both sides of the fence here. The clinical implications of medical cannabis use among individuals with mood disorders are unclear. The evidence suggests that medical cannabis does not increase the risk of harm to yourself or to others. So that's good. But
That's
yeah,
important.
I mean, yeah, the systematic review found what it normally finds, which is
Kind of inconclusive.
totally inconclusive. Lauren, what are the risks and benefits of medical cannabis?
Well, thousands of adults in the US are using cannabis to treat mental health issues such as anxiety and depression. Yet, to date, like Travis was saying, there is very little evidence from published studies showing that cannabis is an effective treatment for any mental health issue. Little is known about the amount of cannabis needed to experience relief of symptoms, how long patients should be using medical cannabis, or whether patients can substitute cannabis for other medications prescribed for their medical conditions. Perhaps most importantly, data is lacking on whether those who use medical cannabis daily for chronic conditions develop similar rates of addiction to those who use cannabis daily for recreational purposes. Clinical trials, which are the gold standard in assessing whether or not a medicine works, have not examined side effects of medical cannabis, such as cognitive effects or development of cannabis use disorder. This is beginning to happen. For example, CBD was approved by the FDA in 2016, which is a highly regulated and dosed. This is quite different from medical cannabis purchased in a dispensary, which is unregulated.
Yeah, so in conclusion, this is another area where I'm extremely disappointed in the amount of
Mm-hmm.
research that we have. For all the hype that marijuana and CBD get, the research is really, really poor quality overall. While there does seem to be good evidence that marijuana and CBD can be used to decrease seizures and also pain and opioid dependence, there are few studies that have similar doses, and the use of CBD and marijuana are frequently grouped together. They're two different things. I think the only things that we can really conclude from this research are that we need more research with standardized treatment protocols in order to find the real potential of these treatments or lack of potential. I'm desperately hoping that researchers begin to take a serious look at doing more research, especially on pain, with the evidence of decreasing opioid use. Because if you're not aware, and I don't know how that would be possible, but we have a serious opioid use problem in this country, and it is very apparent that cannabis is much safer overall than opioids. So finding out if it's much more effective is really important.
Yeah, that's a good thing. And I'd like to see more research on the use of cannabis with epilepsy so that my kids wouldn't have to be on such powerful sedative medications to control their seizures, and so that their neurologists would have some real evidence to look at with treatment protocols and dosage so that they could feel safe prescribing this to patients.
Yeah, I would imagine that they have a lot of hesitancy because of the poor research. They can't.
That is what I've seen, yes.
Yeah, that would make sense. That would totally make sense. Although I mean, personally, if I was the parent of a kid that was having epilepsy and they're prescribing known, not necessarily safe drugs to my kid over and over, and a lot of them, I would probably be a little less hesitant to use.
Yeah, I think that's where a lot of my parents
CBD,
are.
medical marijuana. Yeah, I would definitely be willing to give that a try because the side effects of the other drugs that they're going to prescribe are probably pretty significant.
Yes, yes, indeed.
Well, Lauren, this was fun, even though I feel like we didn't accomplish anything other than proving that my initial hypothesis is probably wrong.
It's always good to be wrong sometimes.
I
be wrong sometimes. That was a contradictory statement. It's good to be wrong sometimes.
I think that there is more than a placebo going on based off of the statewide studies that have seen less opioid use and death. I mean, that's pretty solid evidence in and of itself.
Yeah, that's great. That's awesome. This was fun. Great job, Travis.
This was fun. Great job, Lauren. Thanks everybody for listening, and we'll see you next time.
See you next time.
Bye.
Thank you for taking the time out of your busy day to listen to this episode of the Health and Happiness Podcast. We hope you enjoyed the episode and are getting benefits from our content.
If your life is improving in part due to the information in this podcast, we would greatly appreciate you sharing the episode with your family and friends on social media and leaving us a review so we can continue to reach more people and improve the health and happiness of the community at large.
Thanks again, and we will see you next week for another episode of the Health and Happiness Podcast.